Hello, I'm Annette Young and welcome to the 51%er show about women reshaping our world. Coming up, a Chinese court is hearing a landmark case that could have an enormous impact on the future of the country's emerging MeToo movement. Also, as governments across the world go on a buying spree for Covid-19 vaccines, a group of scientists and health experts have raised concerns that data on gender differences and the virus are not being gathered, which could impact their rollout. We'll be talking shortly to Professor Kent Buse from Global Health 50/50. And the power of music. We meet the all-female quintet in the Congo seeking to empower and educate women in a traditional African society. But we begin in China, where the MeToo movement has struggled to take off in China's conservative patriarchal society. Yet a high-profile court case is putting it right back into the spotlight. A prominent TV host has been taken to court accused of sexually harassing an intern back in 2014. He has denied the accusations. However, it is extremely rare for such cases in China to reach the courts. Ellen Gainsford reports.
Police ask protesters to drop their banners. Chinese authorities view the MeToo movement as a dangerous social force. With signs reading "We oppose sexual harassment" and "Little Shan, we're here for you," Zhu Xiaoshan's supporters gathered outside the courthouse where her case is taking place.
Even if ultimately in this case we don't get a judicial victory, as long as we can show the public that there are people like me, those of us who are victims of sexual harassment, it's already a type of victory.
Zhu accuses high-profile TV presenter Xu Shan of assaulting her when she was an intern at state broadcaster CCTV in 2014. When she first went public in 2018, she sparked a social media storm and widespread backlash. The TV presenter countersued, accusing her of harming his reputation, asking for around $95,000 in damages. Police warned her not to pursue her complaint.
The Wuhan police went to find my parents and told them not to tell their story. Later, the police also told me not to tell the story because the other side involved is a very influential person, and if I tell the story, it will also affect the image of the place he works at.
In China, victim blaming is common, so women are often afraid to speak out about sexual violence. The MeToo movement has struggled to take off in the country.
At
the beginning, China's MeToo campaign was well received and inspired more people to speak out. But compared to other countries, we have many disadvantages, including the lack of openness on the internet.
But in a victory for activists, this June the government brought in a law defining sexual harassment. Critics say it's largely symbolic. While the legislation holds schools, businesses and other organizations responsible, it doesn't lay guidelines for enforcement.
Now, with much of the world experiencing pandemic fatigue as countries suffer from a second or even third wave of coronavirus, much hope is riding on the rollout of vaccines in the coming months. But a group of health experts are raising concerns that many governments are not publishing crucial data about Covid-19 and gender, which could seriously impact decisions about the rollout of the vaccine. This despite significant evidence showing marked differences between women and men in rates of testing, hospitalisations, ICU admissions and deaths. Joining me now from Cambridge is Professor Kent Buse, a co-founder and co-director of Global Health 50/50, one of the three groups involved in the Sex, Gender and Covid-19 project, which have been raising these concerns. Professor Buse, thanks so much for your time. It does seem, with the urgency of the crisis, that many governments have failed to prioritise collecting sex disaggregated data. Why has this happened?
Across all health conditions, we know that they affect men and women differently, and that's no different for COVID-19. And unfortunately, the 5 big burden countries, that's the US, India, Brazil, Russia, and the UK, that account for 50% of the burden of COVID have not been consistent on COVID deaths and cases since the beginning. You asked me why? Well, I can only really speculate. I think on the one hand, it's a reflection of a problem that we see across societies more generally, the assumption that gender simply doesn't matter. The health sector, like many parts of society, is gender blind. When it comes to medical sciences, it's always been built on the understanding of the male body, that there is a male by default in the approach to public health. And I would imagine that's one of the reasons. And in fact, I really hope that the failure to report is rather a benign one of benign neglect. But it's of course of concern that only 10 countries are reporting testing sex-segregated data and less than 100 countries reporting the same data on deaths. And it's even more concerning that the number of countries reporting has been going down over time, for 60% at the beginning of the epidemic to less than 35% today.
Will this vaccine affect women and men differently?
I think there's really two issues at stake here. The first one is around vaccine efficacy, how well it works. And the second is around vaccine uptake, in other words, who takes it. In terms of efficacy, we know that vaccines respond, or men and women respond differently to vaccines. We've seen a pattern of this, and evidence emerging out of Strasbourg University suggests that COVID is no different. And what we see in the case of COVID is antibodies tailing off in men more quickly than they do in women. And that would suggest, I suppose, that men might need a booster more frequently than women might. But I think that, secondly, in terms of vaccine uptake, again, sort of sex and gender, as I was mentioning earlier in relation to testing, we see more women getting tested, and this conforms with a pattern that more women seek out health promoting services. And so we could expect more women to come forward for a vaccine, and therefore, presumably, one would need special efforts to be made to ensure that all vulnerable groups, including men, have access to the vaccine. What we're seeing, unfortunately, is the three leading vaccines haven't reported their results in a sex-segregated manner. And as you can imagine, this is problematic. Presently, we have these science by press release, which simply isn't good enough. They are gender blind, like too much of public health more generally.
Is there not a danger that by raising questions about the rollout of these vaccines, as we are doing here, that this could play into the hands of the anti-vaxxers?
All right. Well, I suppose I should just make it very clear that I'm celebrating this amazing collective achievement, and I'll be the first to get in line after the vulnerable groups have been taken care of in terms of getting their immunization. I should say I'm not an immunologist. I'm not a COVID vaccine specialist. But I guess I would say that I understand some vaccine hesitancy on the part of certain populations that you're, I suppose, alluding to. There's been an infodemic, as the WHO refers to, a lot of misinformation. And so I can understand some organizations or some people being concerned. But at the same time, living in the UK, living in the European Union, we do have incredibly rigorous regulatory systems, and we can be assured of the safety of the vaccines. What I just, again, want to come back to from the point of Global Health 50/50 is what we need to see is more publication of sex-segregated data. We need that data be in the public domain. We need that transparency so the public is more accepting and less skeptical. We need that data in the public domain to reassure the population that these vaccines, in fact, are safe. So that would be our position at Global Health 50/50, Annette.
Professor Buse, we're going to have to leave it there. Thank you so much for your time.
Thank you for having me on your show.
Now, finally, they're called Les Mamans du Congo, or the Mothers of Congo. Hailing from the capital, Brazzaville, the all-female quintet seeks to empower and educate women in a highly traditional society. Claire Rush has the story.
Empowerment, emancipation, equality. These are the themes woven through the sounds of Les Mamans du Congo, or Mothers of Congo. Using pots, pans, and giant mortars and pestles as their percussion, the group fuses their original sound with traditional African rhythms, honoring their cultural heritage while also seeking to challenge gender norms.
African mothers, particularly Congolese mothers, have to work every morning, doing the dishes, doing the laundry, cleaning everything. So to forget this suffering, we sing. That's where I got the idea to create a show that reflects the reality of Congolese women. And that's why we use kitchen utensils.
Singing in their ethnic Lari language, the all-female quintet touches on the unequal division of domestic labor in Congo's patriarchal society. These musicians are speaking from experience. Many of them are housewives themselves.
It's difficult to divide one's time between work, music, and household chores. We've had trouble with this since the band was created. Some women even received threats, forcing them to quit the group. They couldn't come back because their husbands demanded they choose between music and home.
Although most live performances this year were canceled due to the pandemic, the group still remains active in the community through its nonprofit, which teaches young mothers about finance management, healthcare, and family planning. Les Mamans du Congo released their first album, an innovative collaboration with French electronic music producer Robin, last month.
And that's it for this edition. You can also connect with us via our Facebook page, that of course being France24.51%, or do send us a tweet at _51%. So until our next show, bye for now.